right. I
Okay,
guess that's our cue.
it is our cue.
All
Welcome
right.
everybody to this webinar that we've got on nurturing medical professionalism. We're delighted to have Scott Graziano, who is at the University of Cincinnati, to present this today. And with that, I'm going to hand it over to Scott so he can get
All
underway
right.
with this.
Well, thanks for joining us, everybody. Appreciate it. And I'm going to do just a couple housekeeping things here real quick. And I know I lost track on my screens where how many people are on here, but if there's any like burning questions, I'm always happy to stop. And certainly at the end, I'm going to try to leave some time for questions as well. But just let's see if I can get there we go. Just real quick, these are the CME statements. I'll let you guys review these, but you can claim CME credit for both, I think, for participating and also watching. So, and again, just the goals of sort of the series in general. And again, really want to highlight the fact that this is the Alliance for Clinical Education, which is the umbrella organization over all of the educational organizations that we serve. And we're looking to get sort of that broader audience interested in people that are interested in medical education. There's a whole bunch of series. The recordings are available on the ACE website. These are some of the prior series for 101 and 201, and the topics kind of advance as we go along here. But you can get to them. There's a YouTube channel. You can get to them from the ACE website. But I highly recommend browsing the ACE website. I throw out the MedEd brief, a great way to get a synopsis on some hot topic medical education articles. So if you haven't been to the website, please go. And the 301 series for the faculty development, these are the ones that are on there. Obviously, if you're joining today, we have the one on nurturing professionalism. And all of these are based off of the clinical the guidebook for the clerkship directors. So I think this is a good guidebook for certainly if you are a clerkship director. It's on its fifth edition right now. We are going to be dealing a little bit with chapter 14, which is nurturing medical professionalism. The original author was Dr. Paul Coe. But even if you're just interested in UME education in general, you could argue some of these chapters even probably identify with just curriculum in general and GME things and even a little bit of CME. So there's probably a book lying around your medical school somewhere that you could pick up, but I would highly recommend just kind of flipping through it. I don't think you have to go cover to cover. Certainly, you can enjoy some of the webinars that we're putting on here, and then if you want to do a deep dive on anything, certainly can. Just some real brief objectives for today. I kind of wanted to describe just some of the different constructs that are used that are out there to teach and assess professionalism, and go over a little bit about what those mean, and through the presentation, try to filter in like how they might apply to some of the different roles you might have as a clerkship director or as a faculty in UME, and recognize obviously how clerkship directors and faculty in general can impact the learning environment for professional behavior. And we're going to tease out a little bit about what that means, about what professionalism means, because I think we sometimes really pigeonhole it into the learning environment as how we deal with like sort of mistreatment issues. And there's obviously broader implications to professionalism in medical education. And then talk a little bit about maybe some best practices and maybe some models for like enhancing professionalism. And again, when I use that word, really talk about like broadening it out to saying like, that, how do we teach professionalism? How do we role model professionalism? How do we assess it? Not just mistreatment, right? This is a little bit broader than just student mistreatment or, faculty, type issues that we deal with in the environment. Just some disclosures. I have no financial disclosures, just some backstory, which will lead to, we always have maybe some inherent bias in how we approach certain topics. I am a prior clerkship director. People always like to talk about recovering clerkship director. I also happen to be a recovering assistant dean and curricular year director. So I actually supervise the clerkship directors at Loyola. I was at Loyola University, Chicago Stritch School of Medicine for my entire career, and as Gary pointed out, I'm now at the University of Cincinnati in a slightly different role, division director for our generalist division, and trying to find some footing in medical education. But I was also the chair of our professionalism review committee at Loyola, which really supervised the learning environment, wasn't involved in curriculum and teaching and things like that, more of the learning environment process. But again, a little bit of my bias. I was the chair of the APCO Undergraduate Medical Education Committee. We do a lot of basically the work for APCO and the OBGYN clerkship objectives, things like that. I am a current board member for APCO as well. And my background, and sort of my interests in medical education, I have a bunch, but I do a lot. I don't know if I do a lot, but I enjoy sort of like discussing sort of the generations, the different generational learning and generations in the learning environment and the clinical environment. I love feedback. I don't know if any of us really love feedback, but I enjoy talking about feedback and how that implies. And if I throw a little plug out here, this book goes back a little bit. And yes, Gary is one of the authors on this. But if you have any interest in this, and the problem with writing about generations is it gets dated pretty quickly because we're on like Gen Z and Gen Alpha. There's all sorts of new generations coming out. But, this is a quick book that you can kind of pick up. It's a real easy read and just go over a little bit of just how we're dealing with different perspectives and different ideas about the learning environment. So I thought I'd throw it out there. So I can put this down, I think, this whole talk in one slide. That doesn't mean I've solved any problems, but I think if you look at professionalism, if you look at how to monitor it, how to teach it, you could really summarize it with this. If you could come up with a portfolio that could longitudinally assess, collect, monitor things across the learning environment, you could really solve this problem. The problem is it's not the portfolio, right? You can come up with a system. There's great systems out there. There's great internal systems. Problem is you need eyes on it. You need people. You need faculty effort. You need, people that are going to look at it and assess it and talk it over and help people develop and collect it, right? So it's all the person hours that you have to put into it that really make the portfolio successful. But if you could figure this out and really make it work and really support it well, you would really be able to support all aspects of it, from the learning environment to the development to the curriculum. So you'll see it pop out a couple times here where I think the portfolio really comes in. But it's more than just collecting it. Someone's got to look at it, right? When you kind of also to summarize, this was an article from CDIM. This was part of their clerkship director surveys. And I think a lot of the organizations, I know STFM, I think Concept has an annual survey. I know APCO has started an annual survey of the clerkship directors. This was in academic medicine. I put the citation down there, but it was talking about sort of moving beyond the dichotomous assessment of professionalism. And there's a quote in their discussion, and I think it really summarizes and highlights sort of maybe the issue or the problem here. It's professionalism assessment and remediation in medical education currently center on a deficit model that seeks to identify and remediate professional lapses rather than a developmental model that seeks to nurture growth. And I think if you just kind of think about that for a second, we use professionalism really sort of as a stick and sort of that negative model, right? We know what doesn't work, right? We know what causes trouble, and we don't really allow for that growth mindset. Can you get into a little trouble and kind of steer back to understand what that means? Can you highlight or positive aspects of professionalism, right? Can you teach positive aspects of professionalism? And I think we do a lot of it. It feels very negative and it feels like a burden, when in reality it should be an opportunity for growth. So just a quote that I really thought was good. But I'll talk about, there's a couple of places where I'll highlight the article, but this is a good read. So if you could pick that up, I would highly recommend it. So, when you think about just the idea of professionalism, I think for the most part, you think about behaviors, right? You kind of think about like, okay, who's messing around in the environment? You know, are the students doing what they're doing, supposed to be doing? Are they late? Are they turning things in? Are my faculty yelling at people? Are my faculty doing what I want them to do? Are they setting expectations? You think a lot about behaviors in the environment. You think a lot about the environment itself, right? Like the overall environment. What is the culture? Is, you know, we talk about those malignant cultures, right? And what does that mean? But, you know, we think about professionalism as like just that overarching learning environment. There's obviously role modeling aspects to that, you know, where you'd say, okay, well, what are we doing to sort of demonstrate, you know, positives there? And I would argue the idea of professionalism is very subjective, but certainly subjective when you think about like how different specialties approach things, you know, and you know, and again, you know, I think we have, you know, obstetrics and gynecology gets, you know, and that's my home. Obviously, if I didn't say that already, I'm a general obstetrician gynecologist. You know, like, you know, the workday starts at a certain time. You know, we expect certain things to happen in a certain way. And that might be a little bit different when you're dealing with internal medicine. That might be a little bit when you're dealing in the emergency room, right? Like I think the specialties have a little bit different idea of what some of those aspects of professionalism are and how you deal with them and how you deal within those teams, right? Generations look at this very differently. You know, if you go back to sort of our baby boomers, you know, and I'm, you know, full disclosure, I Gen X, you know, 50-year-old, you know, how I approach things and how I see things are very different than certainly looking at my kids. My kids are 14 and 12, right? Like the idea of how they communicate, how they, you know, how they deal with expectations and you know, how I deal as a parent, right? Very different. So a lot of subjectiveness when we think about sort of professionalism here. And again, I talked about feedback. So I'm just going to use this parallel here as we move into the next section. You know, the two things I think about when I'm giving feedback, as we all do, is like you want it to be direct, right? Like you don't want that crazy squiggly line from A to B. You kind of want to connect the dots to say, here's what I saw, you know, and here's the expectation, and here's where I think we need to go with that. And you want it to be very specific, right? You don't want to be, you know, vague about the feedback, and you want it to be directly observable. You want it to be very specific to, you know, on rounds today, I noticed you were late, you know, at this specific time. So LCME and professionals, I don't know that they follow these rules. And again, I don't know that feedback rules necessarily apply to everything. But you know, the LCME and the LCME does a great job. And you know, obviously, and we all have our thoughts on LCME. And if you're coming up with an accreditation, you know, visit, you probably have different thoughts. And if you're filling out the DCI and all the, you know, you're doing your student surveys. But when you look at the function, the main document for the LCME, functions and structure of a medical school. If you search professionalism, professional, you come up with a few things. I'm just going to highlight them here really quickly. So the obvious one is 3.5. And I think most of us are familiar with this. And if you've ever dealt with your learning environment, you've dealt with, you know, element 3.5. You know, and it talks about, you know, ensuring that the learning environment is conducive, you know, and that everybody is sort of displaying appropriate professional behaviors, the students, the staff, the faculty, and that, you know, we're responsible for like evaluating that, making sure it's safe, making sure it's productive, making sure it's meeting those standards. And if not, like, how are you fixing it, right? How are you monitoring it? How are you fixing it? So it talks about professionalism in light of the environment. Okay, makes sense. You can find it in 6.1, very sort of vague here, right? Program and learning objectives is that the faculty of the medical school define the medical education program that allow the assessment of medical students' progress in developing the competencies that the profession and the public expect of a physician, right? Not really talking about professionalism, talking about we should turn out people that are competent for the profession, whatever that means. 7.6, structural competence, cultural competence, health inequities. And this is just a breakout of, there's a subset in this element, but it talks about the knowledge, skills, you know, acquiring the knowledge, skills, and core professional attributes needed to provide effective care in a multidimensional and diverse society. the core professional attributes, right? Like what is that, right? There's a few other places where professionalism is documented, but when you think about sort of curriculum, and that's kind of it for the LCME. So you kind of ask yourself, like, well, what's missing? Well, I mean, they didn't talk about teaching it, right? Talk about like, yeah, you have a safe environment. Yeah, you could take learning environment into role modeling, and we get into the hidden curriculum, but there's nothing in there about teaching medical professionalism, how to do that, where to do it. Now, if you break down into the DCI, the data collection instrument, there are sometimes some different subcategories there that can delve in, but on a whole, kind of vague. And again, I'm not knocking the LCME on that, but just to say, like, you really have to go fishing to say, like, if you want to put this in your curriculum, how to do it, where to do it, how best to do it. So there's some constructs. And again, some of this is pulled from the chapter, so you can kind of read this too. When you think about like teaching professionalism, or sort of like, the professionalism in general, you can have like values and virtues. I'm going to break each of these down. You have behaviors, you have professional identity formation. But, if you're a fan of Monty Python and the Holy Grail, you realize like it's only a model, right? Like this doesn't solve any problems. It gives a little bit of a baseline and an infrastructure, but like there's not a lot of meat here, right? So when you think about values and virtues, you're kind of using, when you think about this model, it's describing a professional person. So you're talking about their strengths. What kind of moral qualities do they have? Their intellectual qualities. What's their expertise? It's really about the professionalism themselves. And the sort of the one-liner is this one-liner here, right? By developing the individual professional, you're creating professionalism. So like, you put people through a white coat ceremony, right? The students come to school, they do their white coat ceremony, they put the coat on, and it's sort of like this, like an aura, and you have like your faculty mentors go up and put the coat on as sort of a ceremony to say you are now a professional. But really, they're throwing a white coat on, right? Like what does that mean? What does that, so like the idea here is that like that should bring some of that mystique and mysticism into it and feel like you're part of something, but it's not really teaching, right? It's not really getting into the weeds of like role modeling or developing anything. And like, how do you assess values and virtue? How do you assess someone's character strengths, right? It gets into like when you talk about feedback, right? Like you're doing something very specific. Like you're not going to talk about like someone how they look. You're not talking about like ethnicity, race. You're not talking about any of those things with feedback, right? Like, so like, how do you assess like the character strength? It's very challenging. Right? Behaviors, I think, are a little bit more, in line with what most people sort of understand and think about. Think of like workplace etiquette, right? Like how you behave in the environment, how you work with the team, how you treat others. This could be like your golden rule, right? Like how you treat others is how you would like to be treated. A lot of this deals with like observable behaviors, things you see, how people act. So you can start to get into, like the direct observation. You can sort of say, hey, I saw this, I heard that, which carries a little bit more weight, right? Like you can kind of say, here's how this interaction went. You can set up frameworks, right? I mean, we have competencies. The GME has like milestones, right? You can get into, even when you create those entrustable professional activities, you build upon milestones and competencies, right? So you can demonstrate these things. You can role model behaviors. You can act like you expect people to act. Problem is when you talk about like assessing it, it's kind of hard to capture, right? Like when you think about, and if people have ever sat on like CCCs, if you've ever filled out a medical student evaluation, right? Like how do you fit that on a Likert scale, right? Even if you weight it, like you can weight things, but like how many questions are you going to ask to really get into the weeds of like how many behaviors are you checking? And then on a 5-point scale, on a 10-point scale, on a 100-point scale, like even if you have anchors, like it's really, I mean, you could do a good job with that, but like there's always going to be that gray zone. And maybe, behaviors are a little too simplistic, as far as how do you capture that from an assessment standpoint. So I think the hot topic here is really professional identity formation. And again, this, you could Google Scholar search it or Google search it or, look up, it's really letting people develop, right? It's how are you evolving? How are you adapting into the professional environment? We put you out there. How are you growing? So that you over time, right? Over time, with potentially some missteps, right? Some mistakes, some, you know, problems where you'd say, can you think? Can you act? Can you feel like a physician? In our particular case, it's very learner focused, right? Like you really want that learner to be developed over time. You want them to reflect on both positive and negative behaviors. You want them to reflect on other people's behaviors, other people's attitudes. You want them to reflect on scenarios they went through and how that affected them and how they grew from that, or what that challenge was, right? I mean, this is it. I mean, this is what you're at. How do you assess that, right? Well, right, if you had a system where you could over time look at where are these things happening, how are they making people feel, how are they growing from it, what did they learn from it, and also objectively you had someone looking at that saying, watching that growth pattern over time, coaching them into say, like how are they using those experiences to grow? So if you had that model and you had that infrastructure there, I think it would be great. Collecting it doesn't necessarily help. It's really the coaching and the growth that comes behind it. Another good article, and again, just I guess I'm doing my job to throw out and advertise for the Alliance for Clinical Education. This was the article. I can't recall when the original article came out. I know it was probably 90s-ish, maybe 2000s-ish, but we came up with a 2.0 version. And I didn't put the citation here, I apologize, but it's within the last few years. But the role of the clerkship director, right? Like the expectations of the clerkship director based on the collective wisdom of people who do it, right? And it breaks down a number of different things. And we're going to go through each of these, but thinking about like, what is your role as a clerkship director, or, what is your role as a medical educator? What should you be thinking about? And you think about some different aspects of it. There's obviously role modeling, and how you present yourself and set those expectations. Talking about faculty development, how do you get others to do that? And the learning environment, right? You're never going to escape the learning environment. How do we keep that a productive place for people to grow and develop? Assessment of professionalism, right? Like thinking a little bit about like, how are you assessing it? Remediation, which can be challenging, and then curricularizing it. How can you build it into the curriculum so that it makes sense and you can foster that growth and development? Probably the hardest part. So role modeling, I don't want to say this is easy, but it might be the easiest, as far as the clerkship director, and you think about like what can you do as a clerkship director? What can you do as a leader? What can you do as a faculty member to role model professionalism, right? Like, if you're a clerkship director, you can have very clear expectations, right? You can run a tight ship, make sure things are organized, make sure your communication is good. When you set your administrative team together with your assistant clerkship director, with your clerkship manager, clerkship coordinator, are you effectively communicating with each other? Are you effectively communicating with the students? Do you have a good relationship between, say, your student affairs and your educational affairs offices and your clerkship? So really, can you run an organized clerkship? Because if you can, students will see that, right? Like, and this kind of goes above and beyond the individual role modeling, but this is like saying, can you keep your department and your clerkship well organized? Can you work with those students, right? Can you get them to getting from that sort of that unconscious of sort of the behavior where they're being a good person, right? Like, and we all want everyone to be sort of that good professional person. Can you make that conscious to where they recognize how to be a good person? They recognize those professional standards. They recognize how to communicate effectively, and they can also recognize when it's not happening, right? And that falls under that professional identity formation, right? So like, you talk a little bit about what did they observe, right? Within the clerkship. You could do this in mid-clerkship feedbacks. You could do this, on daily rounds. What were their expectations before they did it versus what, sort of what was afterwards? Can you demonstrate, physically demonstrate, role model some of that professionalism? And then you have to invite feedback, right? And take a little constructive criticism, even from the students, to say, like, what do you think could have gone differently? What could have gone better, right? So all that goes into like role modeling, both on the administrative level, but I also think on the clinical level as well. You can use these. So faculty and resident development, and I include residents on there because obviously when we deal with our learners, we are, our residents are our learners, but they are also our teachers, right? So they fall into that weird pocket of, like we want them to be developing as well. But we also want them to, be working with the students. Now, if you look at ACE and look at the CD 2.0 document, they would say part of the role of the clerkship director is to recruit and train faculty with help from leadership, right? Like not in isolation, but also provide feedback on performance. And that CDs really should be a part of that developmental leadership team. So if you have a team in your department, CD, the clerkship director, and probably your educational people need to be on that. I've transitioned from Loyola to the University of Cincinnati, and for our department and our leadership team, like we have I'm one of the division directors now, but we have our medical education, we have our program director on there. You get the you want to highlight your educational team as that department leadership because it gives them a little face validity to that role to say they are important. Because sometimes your clerkship directors are dealing with your faculty, dealing with the residents, and they need, and sometimes they are junior faculty, right? Like they are in that early career. So I think role modeling is certainly important here as well. If you expect your faculty to do something, if you expect your residents to do something, obviously that's going to play a part. And I think, having a little bit of infrastructure built in somewhere, I'll talk about this again a little bit later too, but like when I was a clerkship director, we used like the reporter, interpreter, manager, educator, the RHIME model, right? And we broke it down where we took some educational time and each clerkship, we would go through all of the students. We'd have the residents, we'd have some faculty, not as many faculty as I like. I'd collect sort of feedback in a group and we'd throw a slide up and be like, here's, John Smith. And the resident would be like, that guy's terrible. And I'm like, hey, look, I gotta meet with John and I can't tell him he's terrible. So you have to tell me what's giving you that emotion, right? Like, and they say, oh, well, he's always late. Okay, now that's directly observable. When was he late? Oh, we had rounds, So all of a sudden, I would, and, I was collecting this information because I'm thinking, well, I got to meet with this guy and I can't just tell him he's terrible, right? Like I would do my face-to-face meetings or mid-clerkship feedback. But sort of the unintended consequence of that is like all of a sudden things would start to take care of themselves because the residents and the faculty are like, okay, well, they're not terrible. It's like they're late. They're causing this emotion. So like I could pull them aside and be like, hey, John, I noticed you were late today. We expect you to be here at like 5:50 and you were here at 6:15, and that's important. We're trying to keep, we got to get to the operating room. The patients are waiting. Patients' families are waiting. It's very important that we stay on task. They started to do that on their own. So I just use that as an example. I'm not saying RHIME and meetings are the way to go, but if you build an infrastructure, you can start to develop people because they start to learn a language and they can use it outside of what you're doing. So the learning environment, I should have put another hot topic here, right? This is the ultimate hidden curriculum, right? I think this is where we spend a lot of our time on professionalism. And there's a lot of assessments that you can go through here. You got the Y2Q, you got the MSGQ, you've got your clerkship evaluations, you've got all your internal surveys that you're doing across. So you can get a fair amount of data here. And I think from the role of the clerkship director, learning environments probably, in faculty development too, they're tricky, right? Because this requires a lot of help. You get a lot of data and I think the data is important, but the supervision, you need institutional support, you need leadership support. Again, if you're, a junior, early career faculty, you cannot do it alone. And I'll just, as a case in point here, if I throw this out, so an experienced surgeon received comments from students being scary in the operating room and generally ignoring them during surgeries. They feel the surgeon is not very approachable. The new clerkship director needs to address these comments. And where does the LCME, and to be fair, I love ACE. I've been working with ACE long. Where does ACE help you with this, right? Like the document says, like, okay, you're gonna talk to your faculty. You started a couple of years ago, and the GYN oncologist, and that's our scary person in our subspecialty. You guys all have your own, scary person in your specialties, is like ignoring the students and like generally asking mean questions like, how do I do that? What if that person is your chair? What if that person is your, like your boss? What if it's your division director, right? Now, I've been doing this 25 years. I could easily sort of say, how would I deal with this? Well, this is probably a boomer, right? Like this is someone who's a little bit up, maybe Gen X now, boomer, but like, I would go to them and sort of graciously say, you have a lot to teach. You have a lot to offer. Your wisdom is great. The students want to soak it up. Like show them the value that they're bringing. And, like they like concrete examples, right? Like, be like, hey, look, this happened this one time. And it's like, here's a tip to make yourself more approachable. Sounds stupid, but like when you're in the operating room, try to use that student's name 3 times. Learn their first name, and sometime through the case, use it 3 times. Like there's actually data out there to show that in the operating room, like if you use someone's name 3 times, they actually feel engaged. Like give them something very simple, right? Now, I've been chair of the professionalism committee for the entire Stritch School of Medicine, talking to chairs and faculty about these very things. I'm real comfortable doing that. Is a new clerkship director comfortable doing that? Probably not, right? So you need that support. You need that infrastructure to get some of that help. Assessment. We're kind of ramping up of what gets harder and harder here, as if the learning environment weren't hard enough. Assessment. Again, really, you got to set clear expectations, and I think professionalism, and I'll say this a couple times, doesn't really exist in a clerkship, right? It's very longitudinal. We talk about the portfolio and everything, but you want to make sure that you have things that are specific to your clerkship, specific to your learning environment, specific to your day of clinic, right? Like, and make sure those line up with all those overarching goals. You don't want to be kind of on an island saying, here's what I expect, when the school says, yeah, but we only need this, or vice versa. Like you really want to make sure that that's aligned. Now, the real trick is always, is assessment, should it be formative? Should it be summative? Should it be used for a grade? And if you look back at the that CDIM article from Academic Medicine, they talk a little bit about this, as far as how people felt about, using it, whether it was just formative stuff or summative as part of the grade, and what percentage of people do that. But you have to remember, like if we're striving, and I don't know that we're striving for professional identity formation, but you could argue that's more towards the gold standard than other things. Like that's really heavy informative, right? Like you stumble, but then someone says, hey, like, and gives you that hand up, right? And to say like, hey, like, let me help you. And here's where we fell short. Here's where, and then all of a sudden they grow from it, right? So, but then you're going to say, oh, but you didn't pass the clerkship because you did that. Okay. So is that like just creating too much? So, a little bit thoughtful on how much should be formative versus summative. Not a lot of validated tools. But when you look at things, you probably want them to be, use multiple modalities, right? You don't want to just have a form. Are you going to do peer evaluations? That's always tricky, particularly when dealing with students, right? Are you going to do 360s? Are you going to have OSCEs where you're going to have some objective, maybe you can record it, you can watch it back, you have standardized, actors or patients. Are you going to use reflection? That's great. Who's reading those reflections, right? Is that just sort of like a diary for the student, or do you put that in a portfolio and someone can sort of coach based on what they put on there? But really, there's just a lot of lack of standards, and there's a lot of subjective nature to that. So that makes the assessment part a little challenging and sometimes almost overwhelming to the point where people just don't do it. And it's not in a vacuum, right? Like it's not something where you'd say, this is only happening in my clerkship. This is only happening on my service. And you have to remember, like, there are sort of social behaviors that I think as you get into the system and as you progress and you're a mid-level faculty, you're a upper level faculty, late career, you understand sort of like what the social aspects of medicine are. Students don't have that, right? So they are really adjusting to coming, dealing with very much like lecture learning, maybe 2-speed, 3-speed lecture learning when they're recorded, to all of a sudden, interacting with patients, interacting with nurses, interacting with other physicians, right? And how does that fit in there? And so there is that adjustment, and there can be some stumbles there. And I think that's, depending on what the stumbles are, I think theoretically that can be okay. But any assessment really needs to be longitudinal, right? Like, and certainly you're going to identify certain issues and certain time points, and there can be, and you want to identify where those are, but like you want those to be tracked. Feeding forward is probably I don't even know if it's a chapter in the book. It probably should be. It might be in the assessment book. It's a sticky wicket, right? Like a lot of places do it. Some places do not. But like, can you make, that feeding forward be developmental so that we know where the students need to work and we can help them grow on the next clerkship based on how they performed on the first clerkship. There's a lot of issues with that. And again, probably outside the scope of this slide and certainly this talk, but that can be helpful if done the right way. And then the challenges, right? Like reporting and, where does that go? Does it go to student affairs? Do you have like a promotions committee, right? Like, do you have someone that's looking at that? But also the challenges of that, like when you report that forward, like, how does that affect the student, right? Like, how does that sort of get tracked? And could there be retaliation or retribution as a faculty, as a clerkship director, as a dean, right? Like doing that. But when you think about this, of course, again, a portfolio comes up, right? Thinking about that longitudinal assessment, like how can we track it? How can we have it in one spot? So the portfolio solves it, but again, it's really the coaching, the mentoring, the development behind that. When you say portfolio, it's not just a piece of paper. Remediation, again, looking at aspects of, is that formative? Is that summative, right? Like, are there aspects that are, where you'd say like there are opportunities for growth there, but is that going to be part of the grade? Are people going to be failing because of professionalism issues? Regardless of how you're doing it, whether it's formative, whether it's summative, you need very clear, very well documented observations on what happened, right? And so, because if you're going to build off that and you're going to grow off that and you're going to change a behavior, you're going to change a communication style, you're going to do something, you really need to sort of document and say this is what it was. And this isn't just happening for you, right? Whether you're a clerkship director, whether you're on service, this is outside of that, right? Like, and so you really have to rely, when you think of remediation, that's not something that you're going to work on internally. I wouldn't expect a clerkship director to be able to remediate a professionalism issue on a clerkship. And you're going to have to use those outside resources. You're going to have student affairs. You're going to have maybe mental health services. You're going to have counseling services, maybe coaching services, right? So you're going to do that using those outside resources, and that's going to happen again outside of your clerkship. The difficulties with remediation, and again, this gets into on that CDIM article, they pull a lot of this out, but like there's a reluctance to report, and I would argue on many levels, right? Like, student on student crime, right? Like a lot of times, students may witness something, but they're not necessarily going to say anything about one of their peers. Faculty may be reluctant to write that down or submit it on a formal evaluation because they fear that like it's, going to be, somehow retaliated against. Clerkship directors feel the same way. They may not want to forward that on to whatever central authority is monitoring that. And I will say this: the MSPE, the dean's letter, right? Like, and I know, depending on which side of the fence you sit on, whether you're UME or GME, whether you write these letters or whether you read these letters, there's all sorts of opinions. But like, I think we can all say, like, no school wants to sabotage their students from matching, right? And every program wants to know every last detail to make sure that they're not getting something, that they're not bargaining for. And so sometimes what you'll see is like you have to kind of read between the lines, right? Like no one's going to necessarily say, here were some of the issues we dealt with, but they may take out some of their professionalism, positives, right? Where, all of a sudden you're left with like a paragraph that says, yeah, a student was okay. Right. And as opposed to like maybe the flowery statements they put in there. So there's even a reluctance to report on a higher level, right, on the MSPE. There's clearly a lack of faculty development. Again, when you think about like teaching people to work on, how do you get people to actually help you with the remediation process and be professional themselves. There can be unclear policies, unclear objectives, unclear expectations, that can interfere with, how people remediate. There may not really be good interventions, right? Like how do you, depending on what the observable action was or the behavior or how far it got in, like, do you have something that's going to help that? Or is that something that's going to be sort of a lifelong learning thing? Very subjective, right? Like people are just, sort of, it's, again, maybe on one specialty may think one thing and another specialty or another individual might think, and then a delay, right? Sometimes you find out, like 6 months later, it's like, oh man, I remember when that guy came through, and this. And it's like, whoa, like where was that when we were trying to work with that individual? So a lot of challenges. The curriculum, there is actually a whole chapter on this. I believe it's chapter 7 in the clerkship direction. So please refer to chapter 7. No. It's not a vacuum, right? And so really, I think what you got to think about is like, how does this fit into the overarching school objectives? You are going to need help. You can't necessarily curricularize this, just for your clerkship. You have to understand what's happening. What are they getting exposed to, with professional behavior, professional expectations, the professionalism of medicine, what's happening in year 1, year 2, year 3, right? You really want it to be consistent across all those years. And that's where like your curricular year deans, that's where, like talking with other clerkship directors is helpful to try to see how does that thread through across the whole year. And I think, the last thing is the point, right? This is not easy. This is not multiple choice questions, right? Like this isn't like, oh, like we're just gonna put a few, MCQs on there and talk about it. Like this has to be sort of really more grounded. And you really want to capture positives along with negatives, and again, and I even hate to use negatives, but those opportunities for growth versus where are people really excelling with their behaviors, with their attitudes, with their communications, with their patient care, like, and staying late and holding someone's hand, just little bits there, right? Like, how do we capture that? Like, we really, it's challenging. So, and there's our portfolio again, it's just popping up as it always does. I think if you were going to curricularize this, really grounding it in like specific examples is helpful. And again, this would be sort of clerkship dependent, or, maybe curricular dependent, depending on your level. If you're in the medical schools on a dean level, but like, thinking about like dealing with pain management, and the intricacies around that and how can you respectfully deal with that and deal with like patients and, kind of bargain with patients and go, care of a dying patient, right? There's very specific examples that can be, you could argue a little traumatic, right? Like depending on what situation you come up with, but also with a little trauma and you want it to be protective, but there's opportunity for growth there, right? And you really, really got to evolve like the reflection, You got to debrief, particularly if you're going to be dealing with some of these, like, pain, care of a dying patient, right? Like, you can't do that in isolation. You really got to follow up and sort of talk about, like, what did this mean? And again, that gets into that portfolio, that gets into that professional identity formation. Can you rely on your faculty for this, right? Like, and that gets into that faculty development. How good are your faculty at this? How good are any of us at this, to recognize that? And, how can you recognize those teachable moments and pull them out and sit down with the team or sit down with the student, right? A high fidelity simulation, when you talk about, like, could you simulate some of these things? And I think yes, to a certain extent, right? Like, and again, getting into those multiple modalities, like, you can record those things so people can watch back and say, like, when they were sitting with, even though it's a standardized patient, how was their body language when they were asking about something? How was their eye contact? How was, anything? The communication, the standardized patient, how did they feel when the student was actually talking at them? So you can get into some of those higher fidelity things at a cost, right? And again, I think you would need to assess that longitudinally. Having one OSCE, it's nice, but, like, could you have, an OSCE at the beginning of the third year? Can you do it, in maybe multiple clerkships? And then can you do it again at the end? Can you do it in fourth year, right? Can you watch that growth and give feedback and watch the first recording and the sixth recording and see how the changes are, and ask the student if they see how the changes are, right? So it's complicated, but not impossible. But it does take a little bit of thought. And I think, again, thinking a little bit outside of, like, your individual curriculum and thinking about it on the scope as a whole is really where professionalism comes in. I'm just kind of wrap up here because I want to leave a little time for any thoughts or questions or anything. So some thoughts and maybe some, I don't know if these are best practice ideas, but just some things. And again, I gave you sort of my biases, sort of my growth and where I came from and or some of the jobs I've had. But this is important, right? Like, I know it sounds silly to say out loud, but, like, when I think about, like, literally what I do all day, I'm interacting with my patients' families. I have to follow up on maybe critical results. Maybe I don't think that CBC is that big of a deal, but that patient is, like, like, just, like, panicked over, what their blood count is. And Lord knows nowadays, the electronic medical record, it gets released before I see it. So the patient may actually see it and be calling me and be like, hey, what's his number mean? Right? Like, do you respond to that? Right? Or do you, like, let that linger for a week? Right? And I'll be honest with you, I'm division director now, and I supervise, 24 different faculty that are, different varying experiences. I have people that don't check their inbox, right? And I got to deal with that. Dealing with coworkers, you're dealing with literally strangers every day in very sensitive environments. So this is, like, what we do. What's the student focused on? Their exam. Step 2 is looming. It's still a number, right? And they want to match. They're thinking about their applications, right? And I think those are very concrete things, right? Like, they know the numbers. They know there's an exam coming up. They know they have to apply. Professionalism is sort of out in the ethereal sort of field, right? And like you really got to kind of bring it into that focus and be like, hey, look, like, this person, like, has a critical issue going on, and we got to figure it out, or we got to make sure we got to follow up on that, or we got to make sure we communicate appropriately because this person's in a lot of pain. So I think the students, they're worried about, this will go down on your permanent record, right? Like the score, but you could also say, like, even from a professionalism standpoint, if they get that little ding, right? If they get, something where it's like, oh, they were unprofessional or they were late, all of a sudden it turns to panic, right? Because it's like, oh my gosh, like, I was late one time and, like, now I'll never match into my residency because that'll be on my dean's letter somewhere. And so, you got to kind of balance it out between, making sure, how much of that is formative and summative. But I think with the idea of professionalism, like, it's how do you take what we do every day and making it some sort of intentional exercise that the students recognize. Maybe it's a reflection process, but then you as the clerkship director have to sort of say, like, okay, well, who's going to read those and who's going to coach on that? And are you going to do that for 20, 30, 170, right? Like, but you need to make it intentional and bring it into that conscious effort of, like, they're really thinking about that. So again, thinking about professional identity formation, that seems to be sort of the hot topic and sort of where a lot of things are going at this point. Um, but I think, you're looking for growth, right? And you're looking for people to be reflective. When things go sideways, can you recognize that? Or even if you take a step back and you say, wow, that really went sideways. And I think next time I would have done this differently, or I would approach this differently. That's what you're looking for, right? And so like you need to start something. Doesn't have to be big. You want to work within the confines of the school and your clerkship and the objectives and things, but like a small reflection. Um, you just need to use whatever you're doing. If you do something simple, use it, follow up on it. Sit down with the student when they write it, or have people sit down with them and talk about it. It can't be busy work, right? Because if you have someone write a reflection on a life and death experience or managing pain in your clerkship, and you like just crumple it up and throw it in the garbage, or you give it a check mark, like students are going to see that as busy work, and Chat GPT is going to be writing that reflection, right? Like it's that simple. So you really want that growth to say like, this is important. I'm going to read all these, and we're going to sit down and talk. Like, and maybe it's not a reflection, but something. Just start something. Can some of these things be formative? Again, those teachable moments, and you have to. There's a fine line here, and as I said, that's a little vague, but like there can be kind of some one-offs, and you can make some of these future repetitive things one-off by addressing them, and that gets into feedback. That's a whole other talk. But like, is there a difference between being late one time and pulling someone aside and being like, hey, you know what? That's not okay. Here's how our team works. Here's what the patients are relying on. Here's how this, you know, um, let's try to make, is there something going on that made you late? No. Okay, let's make sure it doesn't happen again. Versus, okay, does that need to go on their permanent record? Versus like, wow, they completely copied off someone on an exam. Or maybe you wanted them to write a reflection and Chat GPT wrote that and you somehow identified that, right? Like, so, like where is that, formative line where you can kind of say, this isn't going to count against you, but like, here's how we do things, right? And I think having an infrastructure for faculty, for residents, and again, I use my example of the rhyme sessions that I set up when I was a clerkship director for my mid-clerkship feedback. The unintentional consequences of that was like everybody else got really good using certain vocabulary and approaching certain topics where all of a sudden I'd be giving feedback and I'd be like, I heard, a couple instances, tell me about like your G1 service. I heard you're late a couple times. Like, oh yeah, no, I was late. I wasn't accounting for traffic. My team sat me down. They laid out the expectations, and it hasn't happened since. And I was like, oh wow, problem solved, right? Like, but understanding that like you can get your faculty involved in that. So that was just like a scaffolding that I had created, and it's more than your clerkship. It's not you. It does take a village. It takes a school, right? Like, and dealing with the environment. I'll tell you, there's none of these things are isolated, but one of our old senior associate deans said there's nothing like an action from the LCME to get things moving. Non-compliance moves mountains. And not that you want your school to lose accreditation or get a severe action or anything like that, but we had issues in our learning environment. We created a professionalism review committee that I got to chair until I recently left. But like it does, sometimes those things when they're recognized really move. So like if professionalism is lacking, not just the learning environment, but maybe curricular wise, sometimes the LCME comes in and recognizes those things. It allows you an opportunity to fix. But remember, it's not your clerkship. This is a bigger issue. And I'm gonna leave you with kind of one thing here, thinking about like the carrot and the stick, right? If you go on MedEd portal, if you go on Google Scholar, if you go on an Ovid search and you search professionalism, you'll get a lot of stuff. Get a lot of stuff on professional identity formation. You get a lot of stuff on remediation. You get a lot of stuff on the learning environment and like mistreatment. It's hard to find something positive to say like, well, how are we doing the positive reporting? Remediate, you get whole books on remediation. And I'll say this, like we back at Stritch, before we left, and this was our student affairs dean kind of bought in on this too. we had our professionalism reporting app, right? Like where you could put in and say this person was late or this person punched somebody or was mean or whatever. There was a positive sort of checkbox too, where you could highlight, when you saw a student do something maybe for their peer, or you saw them in a patient interaction, or you saw them do something positive, get something done, work-wise, where you could highlight that. It would go directly to our promotions committee and directly to student affairs, and they would put that in the MSPE, right? Now, how many did we get? Handful, but it's more than zero, right? And so it's kind of how do you change that culture? And again, that takes support from obviously a lot of people. I guess if I leave you with two things, it's the portfolio. And again, I think this really gets into it's not the system, it's everything behind it. It's the coaching aspects, it's the mentoring aspects, it's the development and the reflection aspects of the student. It's not just collecting the information. It's really having a system in place where someone can coach that person to develop and grow. So with that, I will stop talking here. That is my new home and my new email. If anyone is interested, I'm always happy to talk about anything. As again, professionalism is not exactly my expertise, but education and certainly working in the learning environment is. So I appreciate you guys all joining us, and if I could find a way to stop sharing, I certainly would. Yeah. If there's any thoughts or comments or questions, I'm happy to.
Thanks, Scott. This is Elise.
Hey,
Everett. Hey, good to see you. That was a great talk. It's such a difficult area to sort of, I think, bring together. I just put in the chat that, we initially started out we have a LEAP committee, a learning environment and professionalism committee that remediates some of the professionalism reports. So all of the reports go to our director of the learning environment. And that person is the chair of the LEAP committee, and the LEAP committee has students on it. And they, I'm not coming up with the right word, but they look at all the professionalism reports, and then they say, this one is a one-off, we're gonna let it be, not, and just let it go. And then this one, needs to have a cup of coffee conversation with somebody and get some feedback. And then this one's, egregious, needs to go to, if it's like a Title IX violation or, so they sort of determine sort of how they're going to be enforced, I guess, or navigated. And then once that system was in place, we put in an accolade system asking for examples of where anyone, students, residents, fellows, faculty, staff, were demonstrating excellent professionalism. And we now get 20 times the number of positive reports. And it does give you a different narrative or a different lens to look through it at, that most of the time, most of us are doing a pretty good job. And we all tend to see the negative and maybe give a little too much credit to that or pay too much attention to that and not pay enough attention to all the good things that students and others do all the time. So.
For sure. Yeah. And again, I think if you want to, and there was in the chat too about an iPhone app, I'm sure there is, or if there isn't, someone creates it, again, I think that would be great to capture in the moment, because that's what you really want. Like if you're going to curricularize, some of those moments, right? You really need to capture them. And I think that's the challenging aspect is, it happens. It's like, oh yeah, I remember that student did really good with, that one patient, about something, it's like, no, you want to say like, gosh, they were crying. They lost a pregnancy, obviously I deal with, they were in there holding their hand, they were consoling them, they were, talking with the family and going, it's like, wow, like, like that's a good doctor, right? Like, and yeah, maybe they were late once, but like, like I can look over that, so.
Yeah. Unfortunately, we're at the top of the hour, and
No,
Also, unfortunately, I have a call I need to jump off and get right onto. So really want to thank you a lot for doing this, Scott. It's been a great session, and appreciate all the time and energy you put into putting this together
Thanks.
for us.
And if anybody has anything, like I said, happy to email. But yeah, thanks, Gary. Thanks for inviting me. Thanks, Elise, too.